Hi, I'm Helena.
And I'm Debs. We both work at the MS Trust, a charity for people affected by MS. Just a little disclaimer, the interview in this podcast was recorded over Zoom still, so apologies if the sound is a bit iffy at any stage. Please do bear with us.
We'd like to welcome you to the MS Trust podcast, Multiple Sclerosis, Breaking It Down. And this time we'll be talking about visual problems in MS. Multiple sclerosis can affect your vision in several ways. Problem with your sight, such as optic neuritis, can be an early symptom of MS, which can also arise if you've had MS for some time.
To try and explain the ins and outs of visual problems, we'll be chatting to Dr Benson Chen, a neuro-ophthalmologist, about some common eye issues in MS and also ask him some of the questions that you've sent us to ask him.
But first, as I got Debs with me here today, let's start with a personal story about visual problems in MS. Debs, who is my co-worker here at the MS Trust, she also lives with MS and has struggled with some visual issues in the past. So when we decided to focus on visual problems, we thought she would be a good guest to share her story. So thank you, Debs. Would you mind starting off by telling us who you are and how you were first diagnosed with MS?
So I'm Deb. I've been with the MS Trust since March this year. Living with MS, I think probably since I was a child, but formally diagnosed 6 years ago. So I had quite a long pathway to diagnosis.
So what were some of your initial thoughts and feelings after your diagnosis?
I think the overwhelming feeling was gratitude and then relief, really. At the time that I was in the process of being diagnosed, I was going through what would have been my third relapse, and the neuro-ophthalmologist who was investigating what was going on had a range of options on the table for what could be causing the symptoms that I was experiencing, which were double vision. They included a brain tumour, another lifelong condition called myasthenia gravis, or MS. That were the three options that were on the table. And the neuro-ophthalmologist called MS the elephant in the room, really, because I'd already had an episode of optic neuritis 2 years prior to this episode. And this presentation of the double vision was leading her to think it probably was MS. But when I considered the other two sort of possibilities, MS seemed the better of the three options, really. My children at the time they were young, they were 4 and 6. So the thought of a brain tumour just wasn't something I could even sort of go with, really. And the myasthenia, I can never say it, myasthenia gravis, it's also a progressive condition. But it's much rarer than MS. And as far as I was aware at the time, there's a lot less research funding going into that. So really, of all the options, MS was kind of the best one, really.
Yes, it's like having that kind of choice is not...
It's not a great choice,
no,
it
it's
isn't.
not,
But I think it seemed to be the least worst of the three evils, though, at the time. Yeah.
So what can you tell us about some of the symptoms that you live with now?
Yeah, so quite a wide range of symptoms, like most people with MS, but the one that's probably causing me the most sort of problems and biggest impact at the moment is kind of foot drop and balance issues. So up until about 18 months ago, I was an avid runner. I ran 5Ks, 10Ks, half marathons, a bit like you, Helena. But then I kind of had a lot of problems with tripping. Initially, I put them down to things like the hot weather or the cold weather or having a new pair of running shoes or the pavements being too bumpy or something like that. But it was happening more and more frequently. And then at the beginning of the year, this year, I fell in my kitchen and there's definitely no pavement in my kitchen. So I kind of realized that there was something more going on. So I went back to the sort of MS nurse and neurologist and I'm having that looked at the moment. So that's a bigger problem for me at the moment because that's caused a massive lifestyle change for me and that I can't run anymore. So I'm having to adapt with that. Also have, bladder and bowel problems as quite an ongoing thing. And I saw something on the Facebook group the other day that was mentioned about that and made me laugh because somebody described it as a code B, which I think that's what I'm going to call it from now on. So
I belong to that club too. I think I might adopt that sound. Yes,
I quite like to. Yes, I do. So that's the main sort of issues, and it's balance, and then all the other kind of comings and goings of sensation changes that we get as well.
So let's chat about visual problems today then. I myself had optic neuritis a few years ago, and I think I only knew what it was just because I work here and I've read about it because it was very odd feeling of my right eye being blurry. I thought it was my smudge on my glasses. How did it manifest for you?
Right, so going back for me, it was right back to when I was age 4. I remember being taken to see this very scary eye doctor woman because I've been complaining on and off of having cobwebs in my eye and just constantly just complaining. Exactly what you've just described. It was that feeling that there was as a child, I thought it was a cobweb. It was that sort of blurry feeling on my eye. But the day we attended the clinic, there was nothing wrong with my eyes that day. And she sat me down, this woman, and, I remember her scowling at me saying, "What do you mean my cobwebs?" In a really angry voice. I was this terrified 4-year-old. And my mum was kind of, judging me as if to say, "Come on, you just say what's wrong with you." But there was nothing wrong that day, because that day the problem wasn't there. So I was kind of, I think, just seen as somebody that was wasting time, and nothing else was really followed up with that. And then in my dad's side of the family, there's been quite a history of really bad myopia, really short-sightedness. So my dad had quite sort of a high prescription lens, and by the age of 9, I was wearing lenses for vision for vision and distance at school. So I think all of that history was just always put down to that. Whenever I had any problems after that with blurriness, or it probably was again optic neuritis, it was just always put down to just the fact that we've got those issues in our family. So nothing more happened with that. And then fast forward like 40 years on, one day I just woke up and felt I had a slight sort of shadow on my left eyelid, really. The best way I can describe it is if you've got that sensation of having an eyelash that's loose, but it hasn't actually come out yet. So I kept tugging at my eyelashes thinking that I was going to get rid of this shadow, but it wouldn't go. And I was running around with my kids at the time. They were both preschool, didn't think too much of it. Carried on with my day, but as the day went on, I noticed that the shadow had become more of a kind of a black spot, really. And when I focused on anything centrally in the center part of my vision, it was all black. So if I looked at a photograph, for example, of someone's face, the middle of the face was completely black, and I could only see the periphery. So that was quite scary. And as the day wore on, that black spot got bigger and bigger and bigger. I went to bed that night. I didn't even tell my husband about it at the time, to be honest. I didn't know what it was going on. Next morning, I woke up and there was definite eye pain as well. So when I looked to the left, I looked to the right, there was a real pain on moving my eyes. So, and the black spot hadn't got any less. It probably got a bit worse, actually, but I thought I had to do something about it. So I went to see the optician. I did a few tests. She was clearly quite worried. I don't think she'd ever really assessed anybody with that before, and she sent me straight to the eye hospital. They did more tests, and then basically didn't really give me any sort of conclusions as to what was wrong, but just gave me an appointment to come back in a couple of days. I had to have eye drops put in to dilate my pupils, and then I had lots of really horrible bright lights and flashing things shone on my eyes where they were looking to see what was going on. Again, didn't give me any conclusive results of what was going on, but sent me away, and I came back a few days later, and it pretty much resolved. The other thing I'd also had as well was a colour blindness. Yes, I didn't realise this, but I'd lost the vision, the ability to see colour in that left eye as well. I didn't know that until they gave me a colourblind test. They gave me one of those books to look through with the different patterns in. And with my right eye, it was absolutely the way I would normally see it. I could see the contrast. With my left eye, everything was grey. So I didn't even realise that I'd lost the sort of colour in my eyes, or the ability to see colour at that point. But then, yeah, so by 2 weeks, it had completely resolved. There was a little bit of residual lack of ability to see contrast in colours, but that was it. Nothing, no more problems after that. It just resolved, and I was told it was optic neuritis. Somebody did mention at that point that it could be one of the first symptoms of MS, and I think I probably had been on Dr. Google and discovered that for myself, but nothing else was said about it. That was it. It was away you go and carry on, and I did, and it was fine.
So you didn't receive any treatment for it?
No, nothing. It resolved itself completely. But then fast forward in 2 years, I then woke up another day and I found that my vision was really blurry. This was a completely different experience, though. So it wasn't with the pain and it wasn't with the black spot. It was just this kind of sense that I didn't even realize to begin with, but I guess I could see double with everything. So there were just two of everything. Everything had like a blurry second outline. So I actually bumped into a friend on the way to the school on the school run, and she's an ophthalmologist, and told her what was going on, and she sent me straight to the eye hospital, where I was assessed there. And after a morning spent having my eyes looked at and doing all sorts of visual tests, I was told that I had what's called a sixth nerve palsy. So the way the eyes work, I didn't know this at the time, but they work in pairs. The nerves work in pairs, rather. So the nerve on the sixth nerve on this eye, on my right eye, was basically stopping my eye from turning back out towards sort of this side of my face. So my pupil just turned in constantly towards my nose, and it was just the problem with the sixth nerve. So they knew straight away that what was causing it, but they didn't know what the cause of the sixth nerve palsy was. So then it was a case of having some tests to sort of reveal what was going on. So that wasn't instantaneous. She sort of sent me for an MRI quite quickly and said quite sort of there and then that obviously the three options I mentioned earlier on, which could be sort of brain tumor, the myasthenia gravis or MS with probably the three likely causes, but they wouldn't know straight away. So I had a lot of tests done, and then I had the MRI done, and then the MRI came back with quite quickly actually with the results came back quite fast for that with the lesions showing. So then I was a couple of months later I was given the official diagnosis of MS. But in the meantime I had to wear a prism lens on my glasses. So I would normally wear contact lenses, and I couldn't wear contact lenses. I had to have a prism lens on, and that was an amazing little device that if you've ever seen them, they look like lots of little lines of I don't know, it's almost like it's a strange thing to describe, but lots of little lines on a lens, and they basically refract the way the light hits your eye. So even if you've got a problem with double vision in terms of your eye turning in the wrong way, it refracts the light so that you actually see things correctly. It's a really clever little thing.
It's amazing what they
It was
can do, isn't it?
it was life-changing because I had that for 3 months. So it didn't really fully correct itself until sort of November of that year. It started in July, so July, August time. So if I hadn't had that prism lens, I wouldn't have been able to do anything, but it just made me be able to sort of live life normally again, which was great. I didn't have steroids because at the point they didn't know what was causing the issue, so I wasn't given steroids at that time. But as I say, my diagnosis came through during that period of time.
And do you still have any issues, any residual issues? I know some people say sometimes that when the weather is going a bit funny, you're getting too hot. I know some runner I know, when he gets overheated, his optic neuritis starts going back.
Yeah, definitely. I mean, I would say with extreme heat would probably make my eyes feel blurry and weird, and I sometimes get a kind of panicky feeling that something's changing, whether it's the optic neuritis or whether it's the palsy that's coming back slightly, but it's only momentary. The other time I get problems is when I'm stressed or really tired, and then with the stress and tiredness, if I feel that the symptoms are coming on, I get really paranoid about the palsy because I think it's visible. You can see the palsy when it happens. And I really hate the idea that anyone can see that. So if I do get worried or I say overtired, then that sometimes crops up again. But apart from that, I don't have any problems with my eyes on an ongoing basis, thankfully.
So finally, if anybody's listening to this and they think that this all sounds quite familiar, have you got any tips for people what they should be doing?
I guess really just get it checked out straight away. I probably delayed a little bit the first time round by thinking it would just kind of go away, but just get yourself to an optician as quickly as possible just to rule out other things as well, or see an ophthalmologist, get referred to them. And I think for me as well, the thing that I would say I can pinpoint those two relapses to were periods of extreme stress leading up to both of those, for different reasons. And at the time, I wasn't living a particularly healthy lifestyle. I wasn't running or doing exercise, and I really think for me personally, that's the way that I deal with my stress. So I think if you can avoid stress or have something in your life that helps you to alleviate stress, whether it's meditation or whatever it is, or exercise, then that's probably a good thing. I'm not saying that necessarily that will be preventative, but for me, I feel that really helps to keep on top of it.
And I was going to say, when you were saying there about trying not to think about it, then obviously sometimes things gets worse as well. It's like that thing about, don't think about chocolate, don't think about chocolate. I want chocolate, I want chocolate, isn't it? But
absolutely.
Thank you so much for sharing your story, and thank you for being my co-host for a bit on the podcast as well.
Thank you.
So now, if this was a commercial podcast, here's where there will usually be an ad break. But as we're a charity, we don't do that. So instead, we'd like to tell you all about our resources for people with visual problems and MS.
Our website, themstrust.org.uk, has some useful resources on this topic. Head to our A to Z of MS and click on V to read about visual problems and MS.
And there is information on optic neuritis, double vision, and nystagmus, to name a few there.
And if those things you just mentioned, Helena, didn't make any sense at all, let's hope that Dr Benson Chen can make some sense about it. Let's listen to your interview now.
So hi everyone, I'm Benson Chen. I'm a neurologist and a neuro-ophthalmologist. I did my training in neurology in New Zealand and then took another 1.5 years doing special training in neuro-ophthalmology, which is a very subspecialized specialty within neurology and ophthalmology. So kind of you can think of me like as an eye-brain kind of person, but it gives me a unique background and experience in understanding visual problems that can occur in MS, as well as sort of the more common things that can occur in vision generally. I work here at the Cambridge University. I'm based at the Cambridge Clinical Vision Laboratory and also in the Department of Clinical Neurosciences.
So we're here today to talk about some eye problems in MS. And we know that eye problems such as optic neuritis can be a first symptom of MS. Could you talk us through why it's common that the eyes are affected in MS and the different eye problems that can be experienced?
So I think one of the quotes that I think sort of best summarizes or encapsulates how our brain and our vision works is that the eyes look but the brain sees. So what essentially that means is we always think that it's the eyes that are doing the seeing for us, but really the way that the brain works and the eyes work and the way that things are structured is that the eyes are essentially like a camera that sends the information to the brain, which then processes that information to sort of give us a perception of the world around us. So really, the eyes are only there to act as a camera. It's the brain that does all the seeing. And I think one of the sort of really interesting things about the brain is more than 50% of the brain has some sort of involvement with vision, whether or not that be carrying the information that's coming from the eyes to the brain, or pathways that are involved in positioning the eyes, or pathways that are involved in processing that information there. A lot of the brain has to do with vision. And so multiple sclerosis as a disorder that affects a lot of different parts of the central nervous system can essentially cause lesions in any sort of pathway that involves vision, and as a result you can get visual problems from MS by a variety of means. So I think a lot of people with multiple sclerosis and in the community will recognize and understand that optic neuritis is a common occurrence in multiple sclerosis. 20 to 40% of people who develop optic neuritis, that will be their first presentation of MS. But we also forget that there are other things that can affect the eyes and the control of the eyes that lead to problems with vision as well. And so, for example, in order to see well, in order to see one image, we've got to have the alignment of the eyes perfectly straight. And so if one eye is slightly turned inwards or outwards, or if the coordination or control of the eyes isn't quite right, that can potentially lead to issues with blurring, or if the eyes and the way that they're moving are completely separate from each other, that can potentially lead to double images or two very clear separate images as well. So I think one of the other things that a lot of people sort of are very interested in with regards to optic neuritis is, well, if multiple sclerosis is a disorder that affects the central nervous system, then why are my eyes involved? Surely the eyes aren't part of the brain. But I think one of the really, really fascinating things about the anatomy of the eye is, we understand that in order for the eyes to work, essentially light has to go from the front of the eyes to the back of the eyes to the retina to pick up all that information around us. And then that light energy gets converted into electrical energy, and that electrical energy actually is then carried through a neuron, so a big nerve that actually goes from the back of the eyes through the optic nerves, through the pathways in the back of the, in the back parts of the brain to reach the occipital cortex. And so that tissue that carries that information, that optic nerve, actually it's just brain tissue itself. It's exactly the same as brain tissue. And so you can imagine if something can affect the rest of the brain, then the optic nerve is also likely to be affected as well in multiple sclerosis, which is why, optic neuritis and visual problems in MS is such a common occurrence, and a significant issue for people with MS living in the community, because as much as we like to think that after optic neuritis the vision improves, the reality is the recovery isn't perfect. Visual problems will fluctuate, throughout the day, throughout the lifetime. And we also have to remember that, things that can happen to anyone else without multiple sclerosis can also affect, people with multiple sclerosis as well. So I think that's sort of the added challenges of working, within this field of trying to make everyone's quality of life better, particularly if you've already got visual problems as a result of MS.
And what are some of these problems that people are experiencing?
So optic neuritis, I think, would probably be the most common sort of manifestation in terms of vision and visual problems in MS. The other really common one is disorders of eye movement. And so by that, we know that, the brain stem, which is sort of the back part of the brain heading down towards the spinal cord, contains a lot of the control centers of the brain that control your eye movements and where your eyes are positioned and where they should be. And so when you're sort of looking around in different directions, so for example, if I'm looking left this way or looking right this way, different parts of my brainstem are being activated to make sure that the little eye muscles that are surrounding my eye, which essentially act like little pulleys, all of them work in coordination. And so, you know, with my left eye, things are getting pulled that way to look that way. With the right eye, the same pathways are being activated to pull the eye the same direction as well. But with multiple sclerosis, you know, if you've got issues with the brainstem and you've got problems coordinating those eye movements, any sort of slight deviation of one eye or both eyes can potentially cause visual problems as well. And so, you know, that's another, you know, major cause of eye problems or problems with vision in patients with MS. The other sort of big group that I like to think about is the patients, once you've had your attack of optic neuritis, well, does it mean that, you know, the vision comes back completely? Am I going to be completely okay? The reality is, although the vision does improve and, you know, people sort of report that they're seeing a lot better, they don't have that big blurry spot in the middle of the vision, the optic nerve itself, like the rest of the brain, with the scar that's being formed from the multiple sclerosis, obviously, you know, multiple sclerosis, multiple scars, the scars that are there essentially can cause ongoing dysfunction as well. So for a lot of people in, you know, living with MS, some of the symptoms that you might have ongoing or coming back and forward after an attack of optic neuritis would be problems with saturation of color, so things don't look as bright or as sharp. You know, and like the rest of the brain and sort of other symptoms of multiple sclerosis, if you're feeling tired, if you're feeling stressed, if you're feeling anxious, some of those older symptoms will start to come back. So the vision might get a little blurrier, or you might find that actually the double vision's a little bit worse towards the end of the day. And it's not necessarily because you're having another attack of optic neuritis. It's the exact same reasons why, you know, someone living with MS who's perhaps had a previous attack of transverse myelitis might just find that on the good days things seem to be working just fine, but on the not so good days you're finding that, you know, your mobility is a little bit shot or that your balance isn't as good. It's exactly the same with the optic nerve and vision, as well as the control of the eye movements as well. So, you know, people living with MS will be very familiar with, you know, those good days and those bad days, and it's the exact same thing with the visual symptoms of MS as well.
That makes sense. So if I sometimes start getting a little bit of double vision towards the end of the day when I'm really fatigued, so
Yep.
That's nothing to worry about.
No, not at all. So, you know, we always think, well, if it's sort of, you know, those classic symptoms of MS that we're all familiar with, or, you know, even the MS fatigue, which is obviously a massive problem, you know, for the MS community, you almost kind of think, well, if it's not that, then, you know, it must be a new symptom, or, you know, I must be having another attack of optic neuritis. But if you kind of think, well, the optic nerve in itself is actually brain tissue, exactly the same, those sorts of issues will still occur when you're tired, when you're stressed, when you're anxious. And the main thing is, you know, obviously not to get fixated on it, you know, don't stress out about it, because often I find, you know, with the patients that I work with, as soon as you start sort of fixating about it, getting worried about it, you start thinking more about it, those symptoms, you sort of get into a bad spiral. And, you know, I think we're all guilty of that, you know, irrespective of whether or not you're someone who lives with MS or you don't have MS. You know, when we start to feel tired, run down, and we start to focus on our symptoms, a lot of those symptoms become a lot more noticeable, and then it becomes a self-fulfilling prophecy. And so, you know, the main thing is to reassure yourself that actually it's not another attack, it's probably just reoccurrence of my old symptoms. And like with any other symptom that you have in MS, take a break, you know, have a break, let yourself recover, have a bit of a rest, reduce that stress and anxiety. And, you know, if it means having to go to bed, have a nap, you know, reset, you know, write off today, you know, tomorrow you should be absolutely just fine.
Having a bit of a reboot.
Absolutely, having a reboot, I think, is the best way to describe it.
You are not familiar what optic neuritis would feel like or be like, because it can vary from person to person, can't it? What would you sort of expect to see or not see in this case?
Yeah. So optic neuritis is a topic which we can talk about, you know, for hours on end. But I think the sort of key points for the, you know, MS community is that, you know, optic neuritis is obviously a very common presenting symptom of MS, and it's a diagnosis that's made clinically. So what we mean, you know, in the medical world in terms of a clinical diagnosis means that it's a diagnosis that's made based on the information that the patients tell us, what we as the clinicians see on exam, and what we can find on things like, you know, on MRI scan, or even photography in the back of the eyes with, you know, fancy machine like this that I've got sitting next to me. So there's no test that we can do that tells us as the doctor whether or not a patient has optic neuritis. If there was, it would save a lot of time and make life so much easier. But at the end of the day, it still relies on clinical acumen, so us putting together the story and figuring out what's going on. So, with a lot of presentations of optic neuritis, we sort of divide things roughly into what we call typical optic neuritis and atypical optic neuritis. And it's not a terminology that I like to use because, if you talk about typical optic neuritis, often, clinicians, often doctors will say, well, you can't have optic neuritis because, what you're describing isn't typical. But, I think that's a complete disservice to patients because, for patients who are experiencing the disorder, I think, when I think about the times that I've been a patient, obviously want to be really helpful and give, the doctor as much information as they can have to sort of put the story together. But I think, in terms of what is the experience like for someone having typical optic neuritis or, optic neuritis that's associated with MS, often the optic neuritis will start off with discomfort around or actually feeling like in the eye. And the reason for that is when the optic nerve becomes inflamed, like inflammation anywhere else, in the brain or the central nervous system or the spinal cord, it can be very uncomfortable. And we've got lots of little pain fibers that are around the eye. Whereas I'm sure, most of the MS community will know that there are no pain receptors in the brain itself. So when you have an attack of demyelination somewhere in the central nervous system, you won't necessarily feel that pain. But I think we're quite fortunate in the land of, neuro-ophthalmology that with optic neuritis, more than 90% of patients will describe pain, and often the pain is quite severe. So it's not sort of, like a little bit of a headache or a little bit of a discomfort, like you've got something in your eye that you've got to rub. And often the pain is exacerbated or it's made worse by moving the eye around. And because optic neuritis in MS typically occurs just in one eye at a time, sometimes it can occur in both eyes at the same time, but more often than not, it occurs in a single eye at a time. The sort of symptoms that a patient would describe would be pain, worse with eye movements, which progressively gets worse, and at the same time the vision will start to fade out. And it might actually begin with sort of losing color saturation. So if you sort of compare one eye at a time, and that's something I really encourage people to do, if they notice visual symptoms, check one eye at a time. If it's one eye that's affected, so let's say, for example, if I've got optic neuritis in this eye here, my right eye, if I cover my right eye and I'm seeing completely well with my left eye, and then I cover my left eye and I'm only noticing problems in my right eye, that's much more suggestive of an issue with the optic nerve and the eye. Whereas if you're noticing something, it feels like it's just on one side, you sort of cover one eye, cover the other eye, and actually both eyes are affected, it's more likely to be something coming from the brain. Okay, so that's why if you sort of come to the eye clinic, one of the things that we like to ask was, did you sort of check? Did you check and did you cover your eyes? Because if you're noticing it's just one eye, you've got severe pain, the color, you're losing color saturation, you're losing central vision, so vision in the central part of your vision, it's getting really blurry, and over the course of a couple of days, it's getting blurrier and blurrier and blurrier, and the pain is not settling down. That sounds very typical of optic neuritis. There are some things that make me as a doctor very concerned. So if you think that you're having optic neuritis and the vision suddenly goes black within a couple of seconds or minutes or even hours, that would be a medical emergency. Don't sit around waiting at home if you lose vision suddenly. That suggests something perhaps happening in the retina or even a stroke of the eye. The other thing to consider is that if you're losing vision and the vision gradually gets worse and worse and worse, and over say, 1 day or 2 days, the vision goes completely black and you can't see anything out of an eye, that's also not typical of optic neuritis as well, and that's also a medical emergency. And you should definitely either go see your optician or go and see your GP, or if you can't get an appointment with an optician or a GP urgently, then coming into hospital to have that looked at is absolutely fine. I think one of the things that's really important for the patient community to know about, and I think one of the really other common questions that we get is, have I had optic neuritis? If I was the patient, have I had optic neuritis? Is there any way for my doctor or my optician to tell me whether or not I've had optic neuritis? And we all have little anecdotes about, 10 years ago, our vision went blurry for a couple of days. We had a bit of a watery eye, it was a bit sore. And then, you get an appointment or you don't get an appointment, and no one can tell you for certain whether or not you've had optic neuritis. And it's a big deal because, if you've had optic neuritis, potentially there's, ongoing disease activity, and it really should be a big sign that, perhaps, the treatment needs to be changed. If your DMD needs to be changed, that needs to be dealt with. So one of the really cool things that's been discovered over the last 5 years due to research, actually, and it's sort of international research that lots of people with MS have participated in, perhaps even some of the, people who see the MS team down at Queen Square, is that in the eye clinic we have a special camera called an optical coherence tomography, or OCT. And essentially what it does is it can measure the thickness of the nerves at the back of the eyes. And so after an attack of optic neuritis, we know that the nerve becomes thin over time. And so if anyone's had a previous attack of optic neuritis and, we want to check whether or not what they had was optic neuritis, you can do an OCT scan, and that can actually tell us fairly definitively whether or not anyone has had actual damage to the optic nerve. So it's very useful, and it's a really helpful test to do, and it's something that we've incorporated quite regularly as part of our clinical practice. And I think related to that, one of the other things that I think a lot of people with MS who've had optic neuritis will be familiar with is after you've had an attack of optic neuritis, the optic nerve, once it becomes damaged and it starts to thin down, it starts to become pale over time. And so when a specialist or when the optometrist is looking at the back of the eyes, they might notice that the optic disc, sort of, the thing that looks like a fried egg with spider legs or whatever, that actually, instead of being sort of a nice pinky orange color, it actually becomes pale. And, if you've got someone who isn't aware that they've had optic neuritis in the past, even just looking at the back of the eyes at the optic disc can actually tell us whether or not there's been any damage to the optic nerve. And then it's a matter of figuring out whether or not it was related to MS or something else. So if you do have questions about whether or not you've had optic neuritis in the past, or if you just want to get it checked out, certainly talking to your optometrist about it, or, if you're coming for eye appointments and eye checks, talk to your ophthalmologist, and they'll be able to at least give you some clues about whether or not something you've had in the past was related to optic neuritis or not.
Can an optician spot eye problems that are seen in MS?
Yeah, so one of the things that I think opticians are really good at is sort of, having access to all the imaging that we've got access to in the eye clinic. So a lot of the tests that we do in the ophthalmology clinic, any of your high street optometrists or your opticians should be able to have access to those things as well. So we still really depend on our, colleagues, in the community to help us try and identify some of those issues. But the problem with optic neuritis in particular is that there may not necessarily be any signs that the optician or the optometrist can pick up. So one of the things that we look at in trying to help us determine whether or not a patient has optic neuritis is the appearance of the optic nerve or the optic disc at the back of the eye. So if you've ever looked at a photo of your retina or the back of the eye, there's a little bit that looks like a fried egg or a spider with spider legs that come out. So that's the optic disc. So people say, well, what's the optic disc? What's the optic nerve? I think the sort of best analogy I can give you is if you think about horror movies or zombie movies where the zombie's sort of walking around and then the eyeball pops out. There's that stringy thing that connects the eyeball to the brain. That's the optic nerve. And so in optic neuritis, it's that little stringy thing that actually gets inflamed or damaged as a result of MS. When an optometrist looks at the back of the eye, for about 30 to 40% of patients, the optic disc, which is that fried egg thing, it can actually swell up. And that's a good clue that there might be optic neuritis that's there. And so when the optometrist sees that, that's a big clue and a big warning that actually we're probably dealing with some sort of inflammation or swelling or damage to the optic nerve, and it needs to be dealt with and it needs to be seen, fairly urgently, particularly, if someone has developed vision loss very quickly over the space of, 1 or 2 days. The problem though is that, if only 30 to 40% of people have swelling of the optic disc, you've got 60 to 70% of people who don't. And, in that case, you're really dependent on the optometrist taking a good history, giving a good story of, the symptoms that you as an individual, who think you might have optic neuritis, what you're experiencing. Because, if you're saying I've got lots of eye pain, it's worse with eye movements. Before I lost vision, I noticed that things weren't as bright, in the eye when I sort of covered them up. that gives the optometrist a very big clue and a very big warning that potentially we're dealing with optic neuritis and the patient should be seen. And so an optometrist may not necessarily see any signs there, but they'll be very dependent on, asking good history. If it's not optic neuritis, let's say, for example, it's the eye movement thing, it's also very dependent on how the optometrist examines a patient's eye movements. And some, optometrists are very comfortable with that, some aren't. And I think, one of the challenges that we deal with in the neurology community, which, the MS community will be very familiar with, is that in a lot of the medical community and in the general lay community, there's, a massive neurophobia. So everyone's terrified of neurological things. People don't understand neurological things, and it can be a big barrier because if you don't understand what's going on, it's very difficult to advocate for your patients. And so, we'd like to think that all our GPs are fantastic and they can make, spot diagnosis of optic neuritis on the spot. But the reality is that, it's a very difficult diagnosis to make, even for neurologists who aren't familiar or comfortable or seeing patients with optic neuritis or MS, all the time. That actually, as a patient, I think the most important thing you can do for yourself is being clued up and aware of what those symptoms are, what they feel like, what are kind of some of the buzzwords that you should be saying to your doctor, to your optometrist, to make sure that you're getting the care that you deserve. Because I think, for a lot of these things, because it's a clinical diagnosis, it relies on someone telling a good story about what's going on.
I think that's really, really interesting, actually, because when I had optic neuritis a few years ago, but that was about 10 years, or like 11 years into my diagnosis. And it just manifested. I think I had a tired eye, but then it felt like I had a fingerprint on my glasses.
Sort of smudge in the centre part of your vision.
And I kept on trying to clean my glasses, and it wasn't doing anything. I went to the optician and did that field of vision test, and it was like I could see things moving around there, but in the corner there was nothing. And then went into the sort of eye&E, where they did a check of the nerve, and they couldn't see anything, because I guess there wasn't. So they were pretty much happy and kind of dismissed me. So it wasn't until I then spoke to my MS nurse, and she was saying, well, it's probably like a mild case of it, and then we were discussing if there needed to be any treatment. It got better within a month by itself. But I think had I not already had the MS diagnosis and, working for the MS Trust, where I read a lot about these things, I would probably just thought something gone a bit wonky and funny.
I think that's sort of, one of the biggest challenges. If you're not someone who already has an established diagnosis of MS, it can be very confusing because, I've heard of stories where patients almost get accused of making things up, or the optician or the ophthalmologist or the doctor or whoever the healthcare professional is, almost sometimes minimizes the symptoms, because for a lot of people, particularly in the optometry clinics or in the ophthalmology clinics or in the eye clinic, a lot of them are very dependent on seeing the problem that's in the eye. And for a lot of, eye conditions, you can see the problem that's there. If someone's developing cataracts, you can see the cataract. If someone's got a problem with their retina, macular degeneration or retinal detachment, the eye specialist can see it there. But for neuro-ophthalmic disorders, so neurological disorders that affect vision and affect the visual pathways, your eye healthcare provider, your eye doctor, your ophthalmologist, your optometrist, if they can't see it there, it's very challenging for them to make the diagnosis, particularly when taking a good medical history and sort of trying to get a feel of the story of what's going on is very challenging. And so for some people, if you don't have an established diagnosis of MS, it can lead to delays in getting getting a diagnosis of MS. And particularly in this day and age, where we've got access to so many fantastic disease-modifying treatments, having an early diagnosis is really important. And there are also issues with does the optic nerve count as part of the diagnostic criteria for MS and things like that. And it's a sort of an issue that we as neurologists, MS specialists and neuro-ophthalmologists have to grapple with. But I think the key thing that I really encourage people to do is, if you feel that your vision isn't quite right, try and understand what might be going on. If you're being told that actually it's not an issue and things aren't settling down, it's okay to ask for a second opinion. It's really okay to ask for help from someone else. And certainly, in the neuro-ophthalmology clinic, so it's a special subspecialty within neurology and ophthalmology, we're probably the best specialty to deal with these kinds of things. And I think neuro-ophthalmology, we're positioned in a really nice place, I guess, because the ophthalmologists are great at looking at the eyes and understanding what's going on in the eyes, but they're terrible with things like the optic nerve and understanding neurological conditions, whereas the neurologists are great with all the neurological things, the MS, but when it comes to regular things that can happen to the eye, it can be very challenging, and as for the general community, you think, well, surely my doctor should be good at everything. The reality is, we're all good at things in our own lane. We tend not to drift out to other people's lanes. So, having a specialty in the middle like this is really helpful and unique.
What treatment options are there for different eye issues?
What treatments are there? It really depends on what the underlying problem is. So if we go back and talk about optic neuritis, we know from natural history studies. So natural history studies are essentially where, we track a group of patients with optic neuritis, we give them treatment or we don't give them treatment, and we see what happens to their vision. A lot of these studies were done in the 80s and the 90s, and there was also a big clinical trial for optic neuritis. What we understand about optic neuritis is if you don't treat optic neuritis, for most patients, for the majority of patients, and it's a very high proportion of patients, the vision loss will actually stabilize over 10 days. And actually after around 10 days, 2 weeks, the vision will actually start to get better on its own. That pain that we were talking about with, moving the eyes around, that'll actually settle down on its own as well. So after around, 10 to 14 days, after around 2 weeks, 3 weeks, things will actually settle down on their own, and gradually the vision will actually get better on its own without any treatment. And so for most patients with optic neuritis related to MS, the vision and the visual recovery is fairly good. And by a month or 6 to 8 weeks after the initial onset of the attack, vision will sort of recover to a very, very good level. And then after that, we're dealing with, the vision occasionally getting blurry on its own for whatever reason, the color vision not being as sharp or clear as before, and sort of ongoing issues like that. For some patients with optic neuritis, we can treat with steroids. Steroid medication in themselves, as everyone in the MS community is aware of, some of the challenges with steroid medication. The best evidence for steroid medication in optic neuritis is that actually if you're going to treat someone with steroids, it has to be high-dose steroids. So it's almost the exact same dose that you would use for treating an MS relapse involving any other part of your brain manifesting with any other symptom. And all of us know that, high-dose steroids have all sorts of issues, problems with your gut, problem with insomnia, feeling a bit wacky and doolally, all those sorts of issues. And so is there any benefit giving high-dose steroids in optic neuritis? The answer is no, not really. It actually speeds up your recovery. So that whole, 4 weeks, 6 weeks, 8 weeks thing of, the vision getting better on its own, giving you steroids or giving someone high-dose steroids will increase that recovery, so speed it up, but it doesn't actually make that recovery any better. So for most of the patients that I see with optic neuritis related to MS, the first question is, well, how much of a bother is the symptoms at the moment? If it's just one eye affected, you've still got the other eye. If the other eye is actually fine, it's just a bit of a bother, and you don't want to put up with the steroid side effects, then actually most of the patients I see are quite happy not having any treatment, and just seeing how it goes. And I'll bring you back into clinic, in a couple of weeks, usually not more than sort of 10 days to 2 weeks, to actually see what kind of recovery has improved, just to make sure that that vision isn't getting any worse. Because like I said before, if the vision does get worse, that sets off alarm bells that perhaps it's not optic neuritis and we're dealing with something slightly different. So with regards to other visual symptoms of MS and how you can treat it, if it's the issue with double vision because, double vision related to MS is a problem with the alignment of the eyes. If you're having an acute relapse, so a problem right now with the vision and the eyes aren't moving in the right way, one of the easiest things that you can do is just to patch the eye. You can get an old-fashioned pirate eye patch, cover up one eye. If you're needing to have, clear vision for things like reading or using the computer, putting an eye patch on, or even for someone like myself who wears glasses, you can actually tape over one eye with, translucent, sellotape or sticky tape, and just blurring out one eye is enough to actually give you good clear vision in one eye so that you're not too bothered by the double vision. And we know, like any other relapse, if the relapse is involving the brainstem and the part of the brain that controls those eye movements, as things get better on their own, the separation between the images that you're seeing with that double vision will actually start to get better on its own. And what you're left with might be slight off vision, in which case, you might get a little bit of overlap or blurring, which can be quite frustrating, particularly if that's a residual symptom that you're left with, or things might actually just fuse together. And one of the really amazing things about the brain is that, all of us have experienced double vision at some point. If you're sort of reading up close and you can't get your eyes in together, or if you're looking away in the distance, your eyes have to spread, have to move apart. Sometimes with a bit of willpower, focusing, energy effort, you can actually get the eyes to, move in or move out. But it can be very, very tiring to do that, particularly, if you've got MS. And so often in that case, if you're finding that, my double vision's come back, it's a bit of a hassle. I'm trying to read something, or I'm trying to drive, or I'm trying to use the computer. Covering up one eye, is absolutely fine, because that enables you to not have those two images that are there. You're just having that one image that's there. But if you're having those problems, obviously, with driving, it's very important to talk to your optometrist or your ophthalmologist, because there are implications for, after optic neuritis, your degree of visual recovery or what your eyes are able to do will dictate potentially, whether or not you can sort of get back to driving. Obviously, we sort of interpret those things in the context of other issues that you might have with your MS that might interfere with driving as well. So usually, for most people, after an acute relapse of optic neuritis or problems with coordinating the eye movements, things will get better. Steroids improve the recovery or speed up the recovery, but with optic neuritis, I don't think there's any real benefit. With the eye movement stuff, potentially it can improve the recovery. Particularly, you don't want to wait 2 weeks waiting for that double vision to settle down. And if it's really, a bit of a bother, actually steroids might help with that. So that would be sort of a situation where I really encourage someone to talk to the MS nurse or their MS neurologist.
And here are some questions that we got from the MS community. My left eye gets more tired than the right. It becomes blurry and hard to focus. Some days my eyesight is so bad that I can't see the screen in front of me or focus on faces, but my optician says that my glasses are fine. Can you explain this?
Yeah, so that's quite a common complaint that we hear, and I'm presuming that the person who sent the question and probably had a history of optic neuritis, with that blurring that seemed to have recovered, but now you're sort of left with the blur that's there, that sort of got worse at the end of the day, or when you're trying to focus to use the computer. So I think the first thing to understand is that glasses won't necessarily make the image any clearer or sharper. So glasses help with things that are involving the front of the eyeball, mainly what we call the refractive part of the eye. So part of the lens, because we've all got lenses there unless you've had cataract surgery and the lens is removed. Glasses basically helps correct for that, as well as the size of your eye. After an attack of optic neuritis, although for most patients the recovery in terms of, and by recovery, what I mean to say is that the amount of vision that's there does get better. It often doesn't get perfectly better. You might be left with some residual problems that tends to be sort of blurring or not having enough focus in one eye. Glasses, as I said, won't fix that, but you're left with sort of problems with potentially your visual field, so the area that you can see, the clarity of your vision, so the sharpness of your vision, your visual acuity, as well as color vision as well. One thing that I think a lot of people after optic neuritis really struggle with is when you're using a computer, if the computer is really bright, if there's differences in the distance that you're sitting in front of the computer, and also it depends on your age as well, because as you start to hit 40 and older, unfortunately I'm sort of in that camp, the amount of lens power that we have changes, and so we find that you actually need probably reading glasses, or you find that you're sitting further away from the computer. So after an attack of optic neuritis, I think although the vision gets better, glasses won't improve things. See if you can find a distance that helps with with the reading. If changing the distance makes things better, then great. If it doesn't, I think one thing to do is just to have a sort of an internal audit. Are you feeling tired? Are you feeling stressed? Are there other things that are going on that's sort of making some of those older symptoms come back? If there are, have a break, have a reboot, let the system reboot, go back to it. And if all things else fail and you're still really struggling and you still need to basically plow on through and get the task done, patch the eye, cover up one eye. If the other eye seems to be okay, most of us are actually okay with monocular vision, so vision with one eye to do what you need to do, and then you don't need to rely on having that discrepancy between one eye having really good, clear, sharp image, one eye being sort of fuzzy, blurry, and sort of going in and out.
Here's another question. I have a problem looking to the left because my eyes won't work together. I've had this for some years now, but it's getting worse, and my left eye now moves spontaneously to the left even though I'm trying to look straight ahead. I have to really concentrate to try and get the eye back in position. Is there anything I can do about this?
Right, so this is another fairly common presentation or manifestation of visual problems in MS. And so this relates to the control of the eye movements and the way that our brainstem in particular, is telling us how to position our eyes. So it sounds like the person who sent in this question has problems with one eye essentially deviating or moving spontaneously outwards, or potentially, if the eyes are looking a certain way, one eye basically is able to do what you want it to do. The other eye is just taking a little bit longer to either move or it doesn't move at all, okay? So the main symptom that would occur when that happens is double vision, because the eyes aren't working together. For most patients, if this is an acute attack of problems with eye movement control, we know that for most patients, actually the big movements will start to get better with time. You might be left with some residual problems, which it sounds like, this person that sent in the question has had. If it is causing problems with double vision, for most people, if you've got the willpower, the energy reserve, if it's a good day, you might be able to force the eye out and you'll be able to see one clear image without any problems. If you're really struggling with that because you're tired, because there's other issues going on, the simple quick fix is essentially just to patch one eye. So cover one eye, close one eye, and just use the one good eye to do what you need to do. The only problem with just, seeing out of one eye is we lose depth perception, because essentially you need both eyes to be able to tell us, when we're doing the finger nose finger test, where that finger is. And so, with one eye closed like this, it's very difficult for someone to know where it is. But if it's not something that you require depth perception, it's not so much of an issue. Other issues and other things that relate to eye movements, one potential strategy is if the amount of deviation, so the amount of movement that you have, is fairly consistent. So say, for example, at rest, if I'm looking straight ahead down the barrel of the camera and this eye is moving okay, but whenever I try to move this eye, it doesn't really move out this way. Or even if I look straight ahead, this eye is moving okay, this one's turned slightly inwards. What you can do potentially in that situation is, if someone normally wears glasses, you can actually put in a special kind of glass called a prism that actually bends the light, so that when I look through the glasses down the barrel of the camera, my perception is that the target's slightly off, and so the prism glasses will essentially force the light to a slightly different angle, so that when I look straight ahead, the position of the eyes is perfectly aligned. That works for some people, but if the amount of deviation, so the sort of difference between the eyes, is changing all the time, you can imagine the prism glasses won't necessarily be that effective. But it's very helpful, particularly with the deviation being very large, or if it's very consistent throughout, having prism glasses can be very useful. The other issue is the aesthetic problem. And unfortunately, the lay community, if they see someone with eyes, and it sounds really funny to say, but if the eyes are a bit wonky, and I think we're allowed to say that, if the eyes look a bit wonky, one eye pointing straight ahead, one eye pointing to the side or moving out, the general public can be very unforgiving. And if the alignment isn't quite right, and if you're not too bothered by the double vision and you're happy just using one eye, potentially seeing an ophthalmologist, seeing a strabismus surgeon can be helpful, because they can potentially tighten the little eye muscles and pull the eye straight ahead. And so from an aesthetic point of view, it looks great because your eyes are looking straight. The problem with that is if you tighten the little eye muscles, it can obviously affect the alignment of the movements again, and so that can cause more problems with double vision. So for most people, we usually say, don't worry about the aesthetics of it unless you're prepared with the fact that potentially you're going to have a lot more double vision, or if you've only just got vision in the good eye, the other eye isn't working so well. And one of the sort of common things that we see in people who lose vision in one eye is this concept of amblyopia, or a lazy eye. If you're only relying on one eye and you've got a lazy eye, often because you're only relying on that one eye will do everything that you need it to do, to look around, to focus on things. But the lazy eye, because it doesn't really need that information coming in and going to the brain, the camera essentially shuts up shop and the eye will basically start to drift outwards on its own. So that might actually be an issue with what the person sending in this question's had. So if it's an issue with lazy eye and amblyopia and the eye moving outwards because they've had severe optic neuritis, potentially, if you don't have any good vision in that eye, an eye surgeon can potentially tighten the muscles and pull the eye back into alignment, so you're not dealing with those aesthetic issues.
Optic neuritis was how it started for me. Now I got reduced color vision, flashing lights, and both eyes are ridiculously sensitive to light. I wear sunglasses all the time, even watching TV or browsing on my phone. Do you have any other practical tips that might help?
Yeah, so after optic neuritis, one of the sort of common symptoms that people experience is that the color vision becomes what we call desaturated, so things don't look as sharp. So if you sort of look at something red, and it's typically the color red that we use to test, things just look a bit, washed out or faded away. Unfortunately, there's no sort of treatments that we can give at the moment to essentially enhance that color vision. The blurred vision as well can also sort of be an issue, particularly if you're feeling tired, if the recovery wasn't as great, if you're sort of having a pseudo relapse where you've got a cold and there's a lot of bugs flying around at the moment in winter. It can make the vision poor. And I think the other thing that sort of people describe is problems with light sensitivity and glare, because the information that the optic nerve is trying to send from the eye to the brain essentially gets distorted, and like wiring everywhere else, if the wires become a bit frayed, the electricity doesn't get sent to the brain quite correctly. And so even something as innocuous as sitting in a room with LED lighting can be very, very challenging for a lot of people. So in terms of practical tips, I think, for the person who sent in the question, I think the very first thing I would consider is not everything that we experience in our vision is due to optic neuritis or the effects of optic neuritis. Actually, the most common cause of light sensitivity, or photophobia is the medical word for it. A lot of the issues with glare, light sensitivity, photophobia actually are things involving the surface of the eye. So if you've got some issues with the surface of the eye, so problems with your cornea, which is sort of the transparent bit which lets the light in, that can potentially cause problems with light sensitivity. And the most common sort of thing that relates to that is actually dry eyes. Dry eyes is the most common cause of light sensitivity, and the best way I can describe it is, the eyes are a camera, the brain is the computer that processes the information that camera is picking up. If you've got a very cloudy lens, or if the surface of the camera, the glass bit of your camera, if you think about even just your smartphone, yourself, and you're taking a photo, if you've got a big smudge over the surface of your camera and you're trying to shoot a picture in bright light, you're going to get sort of weird halos and arcs all across your picture. That's the exact same thing. And so that's what our brain is telling us, that light is being scattered by something at the surface of the eye. And the very first surface of the eye that we've actually got is the cornea, and the top surface of the cornea is actually our tear film. So that's why we blink, and that's why we produce tears, because we've got to lubricate the surface of our eyes. If the surface of the eyes are not well lubricated, light gets scattered in all sorts of directions, and that can potentially lead to light sensitivity and flashes of light. So I think that's a really important thing to have, the reader get checked out, or the person sending the question, get that checked out. Your optometrist should be able to sort that one out. The other really common cause of light sensitivity is cataracts. And the reason for that is cataracts is the lens that basically sits behind the surface of the eye. Essentially the lens, which is lens shaped, basically goes fat or it goes skinny depending on whether or not you're looking at something up close or looking in the distance. As one starts to accumulate birthdays, the lens starts to get a bit calcified, or what we call opacification, which means that you start getting little bits of calcium and cholesterol and things like that within the lens itself, which makes the window very cloudy. And so when light tries to go through the window or go through the front of the camera, things get scattered in a billion different ways. And I think, one thing that people with cataracts notice is if you're driving and you've got oncoming cars with their headlights, if the oncoming headlights is causing a lot of glare and you're finding that you're getting dazzling vision, potentially that will be an issue with cataracts, and that is something that's really easily fixable as well. So if it's not an eye-related problem, there's a few other things that I'd get your optometrist to check. There's medications, some medications can do it, but if there's really nothing else that's relating to the eye, the optic nerve and optic neuritis can be an issue. If it's not the optic nerve, optic neuritis, some things in the brain can do it as well, and it can relate to migraines. We know that people with a history of migraines will have a degree of light sensitivity. So even if you're not having an attack of an acute migraine, most migraineurs will often have a history of a bit of motion sickness, a bit of light sensitivity, a bit of noise sensitivity as well. And so if it's related to that, often boosting your brain function to try and get enough sleep, make sure you're having enough vitamins and nutrients and things like that, can actually help turn that dial down. And if that's not able to be fixed, you can potentially take medications that help reduce that sensitivity. And finally, to answer the question, if it is related to optic neuritis, what can you do? The reality is there's actually no medications that we can give at the moment. There's a lot of studies at the moment looking at remyelination, which is really good and really helpful and useful, and those studies are being done here in Cambridge. But until we've got an approved treatment, in the meantime, the best things to do is to look at trying to get better sunglasses. So either fit around sunglasses that essentially cover the top, cover the side, so the light doesn't go through. Making sure you change your settings on your smartphone, on your TV, on your computer. And even if you haven't had optic neuritis, I think it's really helpful, turning things onto night mode, because, the intensity of things on your smartphone and computer can make it very, very uncomfortable for people, or even buying a blue light filter as well. So blue light tends to be the light that seems to cause the most issues with light sensitivity. And so if those things aren't very helpful, the next best thing to do would be to talk to your optician about getting special tints on your sunglasses. The sunglasses that you can sort of get, in the sort of pharmacy at the chemist, or even just picking something off the shelf, at a store, usually aren't effective for light sensitivity. So actually getting the right tint for the sunglasses, there are certain tints of sunglasses that are really effective for photosensitivity and light sensitivity. Talk to your optician about that, because there is a solution. So have an explore of all these sorts of things, and hopefully we can get that fixed.
I often get the twitch in my eyelid. Is this MS, or could it be something else?
Twitch in the eye is a very common thing. I get it as well. I think most people would have experienced. The thing I would want to clarify would be, what's the twitch? Is it sort of, just a feeling of the top of the eyelid or the bottom of the eyelid flickering a couple of times, and then that's it? And then when you go to the mirror to see if it happens, you see it happening again. So in medical language, that's what we call eyelid myokymia. That's very common. That's often due to stress, sleep deprivation, drinking too much coffee, caffeine and energy drinks. I think if you've had a lot of coffee and are a bit run down and you're feeling a bit tired, so you drink a bit more coffee, you'll get the twitch. If it's not that kind of twitch, if you're finding that actually the eyelid is twitching all the time, and the eyelid is, twitching all the time to the degree that the entire eyelid, top and bottom eyelid, close completely, that's not related to stress and sleep. That's probably, something I would want to talk to your MS nurse or your MS neurologist about. That might be something actually unrelated to MS. That's probably related to the nerve supply to the face.
My first symptom was optic neuritis, but 6 years on and my eye still aches continuously. Do you think it will ever go away?
Yeah, so that's a really hard question, and I'm really sorry that, you've had to put up with these symptoms for such a long time. So, eye pain related to optic neuritis is typically very severe pain. It's often worse with eye movements, and aggravated by eye movement, should I say. And that kind of pain usually settles down for most people. Actually, most people, for the vast majority of people who've had optic neuritis, most of that severe pain will actually go away completely. It's a little bit unusual to be having sort of ongoing pain 6 years on, especially if it's pain to that degree. I presume, from the person who sent in the question, that it's not that sort of pain, because that's really, really debilitating pain. If it is sort of pain that's sort of worse with eye movements and things like that, it would be very unusual for there to be ongoing inflammation that's there. I think the first thing I would do to confirm whether or not there's ongoing inflammation that's there would be to talk to your MS nurse or your MS neurologist to see what was picked up on your last MRI scan. Was there anything around the optic nerve that was there? Was there anything actually in the eye that's unrelated to MS that's causing eye discomfort? Because, there are lots of other things that can cause eye pain that isn't related to the MS. And I think the reason for sort of being clear about that is, for most people, we understand that there's no pain receptors or pain nerves in the brain. So, if you're having a new attack of, MS with a new relapse or new demyelination, you don't actually feel that pain. But, with optic nerve and the nerves around the eye, actually there's a lot of discomfort that we can feel, and not all of it will be related to the optic nerve. Some of it might be related to, the surface of the eyes, because dry eyes can usually often cause a lot of discomfort. And, if you're finding that when you're blinking or, after a long day, you close your eyes and you kind of feel this zinging thing with the eyes sort of burning, and you sort of blink and rub the eyes and that sort of zinging feeling goes away. That kind of discomfort actually probably is just dry eyes. And in that case, doing simple things like using, eye drops or eye lubricants to just help coat the surface of the eyes, turning off the sort of, light intensity on your smartphone, on your computer, and making sure that, if you're going to be using the computer for long amounts of time, for every sort of, 20 minutes on the computer, look away for around 2 minutes or something like that, and look into the distance, because that really helps as well. If it's not related to dry eyes, if it's not related to optic neuritis, if it's not related to an eye problem, what can you do? For a lot of the MS community, often there might be an overlap with migraines and, headache disorders. Some headache disorders can also cause eye discomfort and eye pain. Migraine itself can also cause light sensitivity, light discomfort, or pain around the eyes. Talk to your MS neurologist, talk to your MS nurse. If it's not something that your MS neurologist is convinced is related to the MS, they might be able to sort of explore other headache kind of things or headache related things that can manifest with just eye pain or eye discomfort. When we say headache and, head pain, it doesn't just mean that the pain is up here. The pain can be, in the front of our eyes, around the temple, and, it would be important for your neurologist to explore that, because there are very effective medications, both, prescribed medications as well as supplements and things that you can take to sort of dampen down that discomfort that's there. So don't put up with it. Talk to someone about it. One thing I would say related to that, I think you mentioned it before, is because of COVID, everyone's been working from home. Your eyes dry out. And the other thing that's really weird and wonderful fact is the blink rate. Your blink rate when you're using a computer actually slows down. So most people, when they're sort of watching TV or using the computer, the amount of times that you blink actually drops. And so you can imagine if everything, you're not blinking, you're not coating the surface of your eyes with the tear film, things dry out very quickly. And so combination of dry eyes, no tear film there, you're kind of staring at a bright screen, you're going to get blurred vision, you're going to get eye discomfort. So actually being, very careful about using eye lubricants or having a break from the computer screen, is really important, irrespective of whether or not you've had MS, optic neuritis or not.
And go away and blink a bit.
Go away and blink a bit. Go away and blink a bit.
Take a blink break. I like that.
And here's another question. At times, my distant vision isn't as good as it should be. I think it's linked to tiredness. My optician says there's nothing they can do, and my vision wouldn't be fully corrected with stronger lenses. Is this normal for MS? Is my vision likely to deteriorate further as my MS progresses?
So that's a really interesting question as well. So distance vision, basically, in sort of medical language, medical speak, it means that we're interested in what we call the visual acuity, which is, how good you can read the letter chart and things like that. After an attack of optic neuritis, for most patients, there is a degree of improvement. Your ability to read the chart improves to some extent. You may not necessarily get the best improvement. It may not necessarily go completely back to normal, but for most patients, the amount of recovery there is fairly good. Like any other MS lesion anywhere else in the brain and spinal cord, if you get tired, if you're stressed, if you're unwell with any other illness for any other reason, if you're drinking lots of coffee, if you're feeling a bit run down, if you're having a bad day, because we all have bad days, your ability to try and focus and get that message from your eyeball to your brain across some slightly damaged wires, the optic nerve, that message isn't going to be conducted as well. And so the vision will tend to sort of fluctuate a bit as well. Unfortunately, glasses don't necessarily improve that completely. And, as we were saying before with one of the other questions, glasses really only helps with the lens and things happening at the front of the eye. There are some things that an optician might be able to do to strengthen the glasses, just to try and squeeze out as much focus as you can when you're looking into things in the distance. But the reality is, if you've had an attack of optic neuritis, for the most part, you should be fine. If you've got enough energy reserved to sort of focus on what you need to focus on. But gradually over time, we will lose that ability a little bit, which, will get worse on those bad days. So I think in that situation, the first thing to understand is, if the attack of optic neuritis has already occurred, the damage is going to be there. Once that inflammation has settled down, like demyelination anywhere else in the central nervous system, for the most part, the inflammation basically has burnt out, and what you're left with is a scar. We know that as we get older, as we start to accumulate more and more and more birthdays, the optic nerve itself will actually thin a little bit over time. So it's really important that we want to prevent any more attacks of optic neuritis, because any sort of more attacks of optic neuritis potentially can cause more thinning of that optic nerve. So if you're not having any more of attacks of optic neuritis, we know that there is going to be a little bit of thing anyway. Usually that shouldn't cause too much problems. I wouldn't expect someone with MS that, if you're having sort of just little episodes of attacks, and I really hate using the word relapsing, remitting, and things like that, because, the sort of terminology about different subtypes of MS is changing. Just because you're having an attack and, in between attacks you seem to be fine, doesn't mean that you're not having another inflammation that's occurring there. I think, if you've had an attack, I wouldn't expect things will gradually get worse and worse and worse with time just after that one attack. What we want to do is protect any more attacks from happening to the optic nerve. There isn't any evidence to suggest that if you're not having an attack of optic neuritis, that the degree of damage to the optic nerve itself is going to sort of get a lot worse, more than the rate that we'd expect you to have with aging. But what we don't know is if there are other lesions in the brain, or if you seem to have more inflammation or even a progressive subtype, what will happen to the optic nerve? And that's one of the sort of big research questions and things that we're trying to understand in our laboratory here in Cambridge, to understand, well, if you've got a different type of MS, or if there's more inflammation there, or if you've got a bigger lesion burden and more lesions elsewhere in the brain, what does that mean? So I can't confidently give you a yes or no answer on that, but I think the most important thing is if you can help us with research, and if there are studies that we're doing to try and understand what happens with vision, then put your hand up, come in and participate. We're not scary, we're really cool here, and I think the patients that come to our clinic really appreciate having time, and actually getting a good explanation or understanding about what's happening with their disease.
I was prescribed glasses just before my MS diagnosis. My blurred vision comes and goes rather than being constant. Is this likely to be due to MS, or could it be just my eyesight? It feels like my glasses are causing pressure behind my eyes. Is this normal?
Yeah, so is that normal? Yes, it's normal. We all get it. Is it MS? Not all the time. Okay, so I think the really important thing for the MS community to understand, and I think also the general public to understand is, and you guys will get it a lot, I'm sure, is that after an attack of optic neuritis, or if you've got sort of a vision-related MS problem, and you're sort of talking to someone about your vision not so great, everyone says, well, why don't you just get stronger glasses? Why don't you go see an optician? The problem is glasses really only help with things relating to the front of the eyes, like the lens, your ability to try and get your eye into the right shape, or the lenses into the right shape to focus your vision. If you've had an issue with optic neuritis, the glasses can only improve things so much. So the other issue is if you've got problems with the alignment of the eyes, even if the eyes are slightly off, you're going to get a bit of overlap and a bit of blurring. As I said, I think before, for the most part, if it's a good day, if you've got enough energy reserve, if you want to force your eyes together, basically you can correct that and that blurring goes away. For anyone with MS, without MS, with a previous history of optic neuritis, without a history of optic neuritis, often when you're reading and focusing, particularly when the vision isn't as sharp or clear, our natural tendency is to try and force our eyes into the best condition that it can be, to try and read what we can read. And you'll see it, if someone's glasses prescription isn't as strong, I do it as well. If I'm looking at something, on the computer and look away in the distance, I know that my glasses are good for here, they're terrible for the distance. And so everyone goes, well, why are you screwing up your eyes? Get stronger glasses. And I'm like, oh, whatever, it's fine. The reality is, when you do that, and when you're doing that constantly, particularly if it's sort of using the computer, looking at sort of electronic devices, and you're not blinking as much, the eyes dry out, it's going to get really uncomfortable, and it feels like a lot of pressure around the eyes, because the only way that we sort of compensate is we've got little muscles that basically pull on our eyeballs. That's how our eye movements work. We've got our eyelids. We've also got little muscles that basically open and shut our eyelids. All of those things can essentially get a bit strained and tight, particularly when you're forcing your eyes into a certain position to try and get, to try and milk out the best vision that you can. So no, it's not pressure, even though we kind of like to call it eye pressure because it feels like something around the eyes or pushing on the eyes. It's not really pressure. If you're concerned about eye pressure is essentially where there's pressure inside the brain or inside the skull, and if there's pressure inside the skull, that potentially pushes the back of the eyes straight ahead. And if things are getting pushed from behind, yes, you're going to get eye pain and it might feel like eye pressure, but at the same time, when we look into the back of the eyes, either with cameras or, when your doctor examines you or when your opticians examine you, if you're concerned about eye pressure, ask your optician, ask your optometrist, ask your eye doctor to see whether or not there's any swelling of the optic nerve. Because if there is swelling of the optic nerve in both eyes, if the back of both eyes are bulging out ahead, then that's real eye pressure. And that's a slightly different problem, usually not MS related. That's, other issues with things going on inside the brain, okay? But be reassured, I don't think, pressure around the eyes or that feeling of pressure around the eyes is related to MS. Unfortunately, glasses aren't going to make it, any significantly better, but sometimes it's just a matter of finding what's comfortable for you and what's the best thing that's going to work for you, whether or not it means bringing things up close and using one eye to look for reading, because for some people, if you're going to get cataract surgery and things like that, you can sometimes actually place special lenses inside the eye so that one eye is really good for reading, one eye is for distance, and then you sort of do this weird thing of closing your eye or kind of suppressing that information. But there's lots of options, and so the most important thing is talk to your optician, talk to your ophthalmologist, and just remind them that even if you have MS, other things can happen to you as well. Don't just pin it on the MS. Things can happen that are not related to MS. To everyone, irrespective of whether or not they've had optic neuritis or not.
If you're struggling with the eye issues mentioned here, what should you do?
Yeah, so if you're really struggling with eye issues, first thing to remember is that it may not be related to MS, okay? Things that happen to everyone else can also happen to people with MS. Common things happen commonly, okay? Dry eyes, cataracts, getting stronger glasses. If you think there's an eye-related problem, first port of call is probably your optometrist. get them to just have a look, do a general check, ask them to have a look at the optic nerves and the back of the eyes. If the sort of explanation is that they're not quite sure what's going on, or it's going to be an MS related problem, speak with your MS nurse or your MS neurologist. They'll be able to get in touch with us in the neuro-ophthalmology clinic. So neuro-ophthalmology is a special service that's based within the ophthalmology departments and the eye clinics usually. We're essentially a group of specialists with training in either neurology, like myself, or with a background in ophthalmology. But the fantastic thing about neuro-ophthalmology is that because we kind of have training in both, we're very comfortable recognizing eye problems, but at the same time talking about MS and understanding what things that can occur in MS can occur in the visual pathway. So definitely talk to your optometrist, talk to your MS nurse, and or worst case scenario, come and see us. Or actually worst case scenario, if things are happening very quickly and changing very quickly, coming into the acute eye casualty is a very important thing to do as well, particularly if you're concerned about optic neuritis.
So we've heard a little bit about research here. What places can people go and look if they want to get involved with research that you're doing here? This is Cambridge, obviously, but also across the UK.
Yeah, so we work with a lot of patient advisory groups and patient organisations like the MS Trust. And if you sort of check out the MS Trust website, if you have a look at the Clinical Neurosciences webpage at the University of Cambridge, a lot of the studies that we're doing here, will be advertised on the website, and even just talk to your MS nurse or your MS neurologist, because there's a massive network of, clinical and research people working in the field of MS who are very clued up as to, what are the current things that are happening, and we're always looking for people to participate in research. I mean, some of it, as much as we'd like to think that a lot of it is, clinical trials of trying new treatments and things like that, actually the most important thing is actually just to understand what happens in MS, because before we can understand whether or not a treatment works, we actually need to know, well, what does MS do? And so there's a lot of studies into that as well. So, definitely check out all the resources that you've got access to, and we look forward to seeing you in Cambridge.
Great. Thank you so much.
You're welcome.
Oh, that's very interesting to hear all about these eye problems. And I feel like, we talked a little bit about this before we press record, that eye problems doesn't actually get talked about so often. You hear about it being often manifest as the first symptom of MS, but then you don't see so much more about it. I find it's just like, that's what we hear, that it is the first thing, but then not much more.
Yeah, and I think I was saying to you before we started recording as well that I found it really difficult to find out anything about eye problems. Whether before I was diagnosed, it's sort of two of my sort of symptoms, main symptoms before I was diagnosed, were obviously eye related, but I just couldn't find out information. And if I did speak to people on different networks to do with it, it was kind of always, because it was one of their first symptoms, it was something they'd often kind of forgotten about. They didn't know the detail, they couldn't remember the detail, and I just found it really difficult. At that point, it was making me think I didn't have MS. So in some ways, it was actually scaring me more in some ways. But yeah, it's there isn't a lot of information about this, so I'm so glad that we've done this podcast.
Yeah, I think it's what Benson was saying about that sort of how it sort of sits in between two worlds of the sort of the world of the eye, the optician and the neurologist. So therefore, I think it sometimes does get a little bit forgotten. I don't know what your experience with opticians are, but I find some opticians, they get really interested when they're like, oh, so you have MS? And then they start asking me. Other people don't really want to touch it. I do remember once going to the optician and I was starting to feel like there was something sort of slight. It wasn't a twitch because there was nothing happening on there, but it was something that was slightly feeling like a tug on there. And I went to the optician and I said, it doesn't feel normal, but I can't explain it. And he got so frustrated with me because I was like, well,
really?
You just can't explain it. So were you wasting my time here? And it's so hard because you just end up feeling a bit stupid. And because it was the eye where I've had problems before, I was sort of just wanting to make sure that there was nothing. But you don't want to feel like a time waster. But I feel like after talking to Benson, you surely feel like you should, if you feel like something is iffy, then maybe contact your MS
Yeah.
nurse, and then you get referred to someone else, or to
Yeah.
actually see the specialist that sits on the chair between two.
Absolutely, yeah. I think, no, I agree with you. And I think when I go to my opticians for my sort of regular checkups, they are always really, I think we are a rarity, aren't we? So they're really interested. As soon as you mention you've got MS, they want to know all about it. And I usually have to go through my case history with them every time, even though it's often the same guy that I see. I don't see him for 12 months, so he asks me to sort of tell the whole story again and again and again. But yeah, I found when I was diagnosed, I suppose partly diagnosed really by the neuro-ophthalmologist. She does very much sit between different things as well. So I think having her insight into MS as well in some ways was, I don't think it was a softer approach than perhaps seeing a neurologist, but in some ways she reassured me a lot more before I was actually diagnosed that the symptoms that I was presenting with at that point, and because of the age that I was at presentation, would probably lead to a not a milder diagnosis, but like a better prognosis really in the longer term. She was very much at pains to say that a big number of people are diagnosed with MS in biopsy, not biopsy, post-mortem, that's the word I'm looking for. After death, because there's a huge number of people that don't realize they have it, and that kind of I really held on to that. That really helped me to deal with the diagnosis better, I think, knowing that it just didn't feel quite as scary as seeing a neurologist straight away and thinking, right, what are all the options here? It was kind of like we were going down that path, and it kind of, I think it helped a bit.
And I think, some of these eye problems can be so scary as well, because like I said, for me, because I'd read so much about it, I was almost like, okay, well, this is what it is. I had some friends who she was diagnosed when she was a teenager, but she ended up getting like a really severe case of optic neuritis when she was on a work trip. She'd never sort of told people that she had MS, and suddenly just went completely blind in one eye. And it was terrifying, and she was abroad as well. So trying to get to get help straight away, and then explain to your boss that this is going on, but then maybe not being able to share the whole picture because she didn't want to come out with her having MS. So I think it can be really quite a scary thing if you don't know what it is. Because
it can.
Because obviously people just think about going blind, don't they?
They do, exactly. That's what I thought it was. I think when I went to see the optician as well, as I mentioned earlier on, she said she was definitely worried. I could tell from her body language and the way that she was trying to contact the eye hospital when I was there. She was trying to speak in a calm voice, but I knew that she was really flustered. And I think she actually thought she had, a woman in her 40s in front of her that was basically having either a retinal tear or something that was going to cause blindness. She definitely, but she also didn't know what it was because I didn't kind of fit the criteria for those systems straight away. I think there was a bit of confusion. But something else that you just reminded me of there was at the point as well when I was having multiple neuritis, because I didn't have a diagnosis at that point. I can remember also having issues with work because I had to take some time off my work, and I met up with my boss, and she was looking at my eye and saying, "Well, I can't see anything wrong with your eye," because you can't, obviously, because it's optic nerve issue, But she kept saying, "Well, there's nothing wrong with your eye; it doesn't look strange." And I was like, "But I can't see out of it properly," And I remember having to that made me more stressed because I had to then fight my case for saying, actually there is something wrong, but you can't see it. So that's the other thing that kind of causes stress. And as you say, from the outside, again, we always say it's an invisible illness, but from the outside, you really can't see what someone else is going through in terms of their senses, in terms of how you're looking out. So yeah, your friend that you mentioned there that would be absolutely terrifying to be away from home when that happened. It was bad enough for me when I was at home, let alone.
I think also talking about other things, I've never sort of had a proper diagnosis about the double vision, but I do certainly know when I'm getting tired that I start going that. And I felt it was quite interesting what Benson was saying, because he was saying about when people are working from home much more, apparently blink rates and things like that have changed, which sounds absolutely crazy, but it sort of makes sense. When I'm working here, I don't have any air conditioning. When I go into the office, my eyes go super dry, and I really struggle. So if I'm staying in the office for a long time, I'm sitting there going, with the screen, and it's just, and I feel like that thing about going away and taking a blink break, it sounds a bit silly, but actually it's such a good thing because you need to lubricate your eyes.
You do, absolutely, and that's the other thing as well. So I use eye drops now as well. I suppose I didn't mention that earlier on, but I do use eye drops between sort of 6 and 8 times a day now, and have done for the last few years. So because I also suffer with dry eye as probably the result of MS too, but and that's something that's a new thing for me. it's not too bad. You can use the eye drops and it's sort of controllable. But yeah, you're right. I've noticed a difference between not working in an office as well. It has an impact on that for sure.
It's funny. One optician said to me as well with double vision that you could sort of do a bit of an exercise of like, looking away from the screen and then kind of bringing up a pen and then focusing on that and then sort of bringing it in and out of vision. And when sort of the double vision stops, then sort of stay and just like almost like trying to refocus the eyes a little bit. So there's definitely little tricks that you can try to do, but sometimes you just have to shut the computer down and go, okay, that's it. I can't do any more of this now, and just rest the eyes a bit.
Yeah, definitely. Remember, the MS Trust is here for you if you have any questions about MS, whether they're related to eye issues or not. You can contact the MS Trust Inquiry Service between 9 o'clock and 5 o'clock, Monday to Friday, except for UK bank holidays, if you have any questions at all about life with MS. We're available on 0800 032 3839, or you can email the Inquiry Service at ask@mstrust.org.uk, and someone will get back to you as soon as possible.
And you can also find the MS Trust on Facebook, YouTube, Twitter, and Instagram. And you can find this podcast on Spotify, Google, and Apple Podcast, and Amazon Music, and also on YouTube now. Get in touch, and like they say, like and subscribe. Talk about these visual problems. Let us know what you thought about this episode. Our next podcast will be on the topic of cognition in MS. That's another very popular topic. So if you have anything to say, or I was going to say lose your word. To remember, now I'm doing it.
Exactly. It's a great example, isn't it?
A great example of it. So if you have something more to say than I do, clearly, on the topic of cognition and MS, please get in touch with us, because we would love to hear your stories or your comments on this, and it might be featured on the episode, and you can remain totally anonymous. You can drop us a voice note or a message via WhatsApp on 0745830326. Alternatively, you can email mystory@mstrust.org.uk. And finally, we'd like to say a big thank you to Anne Chapman Audio for the music to this podcast. Now I'm going to go and take a blink break from this Zoom call.
Me too. Thank you.
Bye.